Now, if we know this Parkinsonism, it has various synonyms like idiopathic or primary Parkinsonism. It is also called hypokinetic rigid syndrome, paralysis agitans, and shaky palsy. These all will tell us about the neurological status of this particular group of patients. And if these patients, they have got fracture neck femur, then because of this neurological associated complications in these patients, we have to plan the treatment. And fixation of a fracture in this particular group of patients is definitely going to be better as compared to orthoplasty. Now, if we see fracture neck femur, basic, it may be a subcapital, transcervical or basicervical based on anatomical site of a fracture. And if we see classification wise, we can have type 1, type 2, type 3 and type 4. If we see type 1 and type 2, where you have minimal or no displacement, type 3 has a minimal displacement and type 4 is a total disengagement. But if we have a good anatomical reduction, then definitely fixation can give us good union and we can achieve whatever we are aiming at. Now this is the same where we have we can reduce this fracture and we can fix this fracture, definitely going to give a better outcome as compared to orthoplastic group. Now there are associated neurological things which we have to keep in mind. We cannot treat them this as a regular or routine patients with that particular age group, and because of neurological condition, associated condition, we have to decide the treatment plan. Now clinically they may be ambulatory or non-ambulatory. If patient is ambulatory and has associated pain and discomfort, then we have to choose the treatment accordingly. If fracture is displaced, then they will have a standard presentation like a deformity at the hip, shortening and inability to walk and with a restriction of the movement. Now non-operative treatment also has a role, because if your fracture is undisplaced and patient just has a pain, then we can keep these patients non-weight bearing and we can get the union at the fracture site, provided we treat the associated osteoporosis or osteopenia with medical line of treatment. That will definitely help us in getting a good result. As far as surgical is concerned, main goal is to get good reduction. That you can do by close reduction or by, if required, open reduction. Like in type 1 and type 2 fracture, where you can just go ahead with a close reduction because already there is not much displacement or no displacement at fracture site, then fixation will definitely give us a good outcome. Now these are various modalities used in past and for treatment of fracture neck of the femur, and they have evolved, and presently we are here with FNS like system. We have evolved from cannulated screw fixation to DHS with derotation screw and with the FNS system. Definitely as we have evolved in the implant, definitely it has going to give us a better and stable fixation as compared to the previously available implants. Now this is a case where we have seen fixation done with 3 cannulated screw, but it has its own complications, and definitely the associated type of the fracture is also responsible for the complication. Like type 3 and type 4 fracture, definitely chances of avascular necrosis or a non-union or a malunion, it's definitely going to be more as compared to type 1 and type 2 fractures. This is another mode where we can use a derotation screw with DHS. This is definitely a stable fixation. And this is a newer implant, FNS, which definitely is better as compared to the previously discussed implant biomechanically, and it gives a better outcome as compared to the previously available implant. Now another group of implant which can be used for fixation of this fracture may be intramedullary nails with the intra-locking screws. Now FNS system definitely superior as compared to cannulated screw and as compared to DHS with the derotation screw. Fixation among this fracture definitely has its own group of complications like avascular necrosis, broken hardware, and definitely may need to undergo a reoperation. That is a main concern. But if we think about doing arthroplasty in this group of patient, which also has associated complications like dislocations is the most important complication, or maybe a periprosthetic fracture is another complication which we have to keep in mind in this group of patient. This is one patient where we have done fixation with the help of FNS, and outcome is very good. Patient is definitely ambulated after fixation. Another case where we have done fixation with FNS, and this definitely gives a very good result as compared to other fixation modalities. If you see the literature, definitely literature also supports the fixation of this group of fracture in type 1, type 2, and if you get a good anatomical reduction even in type 3 with good bone quality, you can think about fixation of this particular group of patient. There are a lot of supporting articles which also suggest and help us in, which also suggest to do a fixation in this group of patient. Arthroplasty is another group, but definitely this is a very good fixation where you have a very nicely fixed bipolar implant here with cement, but it definitely has lead to dislocation. This could be because of the spasticity or could be because of the muscle imbalance because of the associated neurological conditions. In conclusion, proper selection of a patient with good bone quality and depends on the type of fracture. Type 1, type 2 can definitely be fixed with the implant, and we can avoid doing a expensive surgery like arthroplasty. And arthroplasty is definitely an option for type 3 and type 4 fracture, but fixation definitely has a role if bone quality is good and if we can have a good, better fixation and stable fixation. Because main aim is to ambulate them and take them out of the bed and do a rehabilitation at the earliest. And it is another important advantage of fixation is a cost, because if you go for a joint replacement surgery, definitely it involves a lot of cost. If you want to do a constrained hip, then again the cost is going to be more as compared to the fixation. Thank you very much.